I'm Dr. Rachel Dolhun, Vice President of Medical Communications at the Michael J. Fox Foundation for Parkinson's Research. Today I'll be talking about motor fluctuations. Motor fluctuations are what we call off times, which are periods when medication isn't working well and symptoms like tremor or stiffness return. They can come on in a variety of patterns. One of the most common is what we call a gradual wearing off. This would be when medication like levodopa stops working gradually before the next dosage of medication is due and symptoms return. Another common way would be when a medication dosage doesn't seem to take effect quite as quickly as usual, or it doesn't take effect at all. If you have motor fluctuations, there are several management options available. It's really important that you discuss any medication changes with your doctor ahead of time. For people with motor fluctuations, separating levodopa from meals can be helpful. Protein can interact with levodopa for absorption, so separating levodopa from meals that are high in protein can help medication to work a little bit better. If that's not enough, medication adjustments may be necessary. Again, it's really important to discuss any medication adjustments with your doctor ahead of time. If you experience gradual wearing off, the amount or the frequency with which you take levodopa may be increased. Or your levodopa may stay the same and a second medication added to boost its effect. A third option may be to change the formulation of levodopa to a longer-acting preparation. 2 medications in this category were approved in 2015. One is called Ritari. This is an oral capsule that contains both immediate and extended release beads of levodopa. And another is called Duopa. This is a gel formulation of levodopa that's designed for continuous infusion directly into the intestine where the levodopa is absorbed. That's a medication that's used more in people with advancing Parkinson's disease. If you experience sudden or unpredictable off periods, you may want to have a rescue medication on hand. There's an injectable formulation of a medication called apomorphine, which is a dopamine agonist that's available for these situations. For some people with very significant motor complications and fluctuations, deep brain stimulation may be an option at this point. Figuring out your medication regimen can be a trial and error process. It might be helpful to keep a motor diary for a few weeks where you can log your symptoms and how long it takes your levodopa to kick in, how long it lasts, and if you have any side effects, particularly those dyskinesias or those abnormal, involuntary, uncontrolled movements. Noting these things can help you and your doctor work together to find the best regimen for you. Motor fluctuations are thought to develop due to a combination of Parkinson's disease itself and the medications used to treat it. Parkinson's causes a loss of the cells that make dopamine in the brain, and as the disease progresses, more and more of these cells are lost, so the brain depends on medication to supply its dopamine. Because of the way that traditional formulations of levodopa are given, the levels of dopamine in the body and therefore the brain fluctuate. Over time, the brain has increasing difficulty adapting for this, and this can lead to motor fluctuations. Researchers believe that a more continuous and constant level of medication in the blood and therefore the brain may help avoid or at least lessen motor fluctuations. That's the idea behind several of the medications that are in late-stage development. One of these is called an accordion pill, which is designed for slower release and absorption from the stomach. Another is a liquid formulation of levodopa that's designed for continuous infusion under the skin, either through a device like an insulin pump or a skin patch that works like a pump. There are also some medications in late-stage development for those sudden and unpredictable off periods. One is a reformulation of apomorphine that's designed to dissolve under the tongue, and another is an inhaled form of levodopa that's given through a device like an asthma inhaler. You can learn more about this and other topics in Parkinson's by visiting our website.